Hey everyone, how are you this week? This is Dr. Sage coming from the clinic right here. We're going to be talking about some x-rays. So I'm in our x-ray area and I wanted to talk about why x-rays are so important in what we do. I get a lot of questions a lot of times from new patients about, well doc, why do I need to do new x-rays? My last chiropractor didn't take any x-rays, or sometimes they'll take x-rays at like a hospital or something along those lines, and they're not done correctly, and the x-rays become very important for me in providing the right care for you. And if I don't get the right x-ray, or if I don't get the proper information, sometimes we can do things that may make you worse. Sometimes it may prolong your care as far as not getting better. So there's a lot of reasons why we take x-ray, but primarily two of the main reasons. I'm going to show you two examples here on some typical cases that came in, and if we didn't have the proper diagnostic tools in place like x-ray, then these patients wouldn't have gotten into the right type of care setting. So the first one I'm going to show you is a patient who came in mid-30s, no real significant history of anything, but she was complaining of headaches. And I did find some things on her exam, chiropractically speaking, in her back and her neck that would lead to headaches. But once we saw what was going on in the x-ray here, we made the proper referral, and she was able to get that taken care of. So if you can take a look at this x-ray here, this particular patient ended up having a tumor in her chest. If you notice the lung field here, you got this big white area right here. So this big area right here, this, not so much this part, that's the heart, but this area here and goes all the way around like that, is a tumor in the chest. And so once we were able to see that, headaches or not, that becomes the priority. So we were able to refer that patient out. She ended up getting surgery within the next couple of weeks. They took the tumor out, and luckily it was benign, but her headaches actually went away afterwards as well. So that is one of the main reasons why we've taken x-rays over the years. I've been in practice for 12 years. We've found a handful of stage 4 cancers. Those are always really scary, but it's better to know and then be treating these people not knowing and potentially causing a lot more damage. The next one that I'm going to show you is a case where the guy came in with standard low back pain, and we see it all the time. And in my exam, if I didn't pick up on this, I would have adjusted this guy and made him much, much worse. And I'll show you his x-rays here. Now, I still worked on this guy, and he did really well with care, but if I didn't have this x-ray, I would have provided the wrong adjustment. These x-rays allow me to provide the right adjustment for him, and it made him much better. So in this case, you can see this bone right here, and you might have to zoom in a bit there. This bone right here, that one, L5, has gone way forward of the sacrum. This is S1, the sacrum. That right there, they should be in alignment like that. And you can tell obviously it's not in alignment at all. And if I would have adjusted this guy on L5 where his pain was coming from, he would have gotten much worse over time. Or not over time, but really immediately. So that's why x-rays are so important. It allows me to provide the adjustment to you, the individual, versus just going off of what textbook might look like, or what I can feel. It's always better to see rather than to guess, and I'd rather know what I'm working with and provide a better, more specific, concise adjustment to the patient. So that's our tip for the week. Thanks for tuning in. We'll see you next week.